What if everything you thought you knew about walking for health was incomplete? We've been told for years that walking is the best, easiest exercise, especially as we get older. And for many, it absolutely is. But what if for some of us, pushing through those daily steps, especially when our bodies are sending us signals, isn't helping us live longer or protecting our hearts, but actually doing the opposite? It's a painful reality for many who are trying their best to stay active, only to find themselves more tired, more achy, or even struggling with their heart health, wondering why their dedication isn't paying off. The secret isn't to stop moving entirely, but to understand that for specific health conditions, walking less or walking differently might actually be the key to better longevity and a stronger heart. In this video, we're going to uncover which health conditions mean you should rethink your walking routine and what alternative, heart-friendly movements you can embrace instead. This isn't about giving up on activity. It's about smart, personalized movement for your unique body. Watch to the end for something that will truly surprise you about how you can best care for your heart. Let's dive right into the first condition where you might need to reconsider your daily strolls. And it's something many of us experience as we get older: severe joint pain, particularly in the knees, hips, or spine, often due to advanced osteoarthritis. Imagine trying to walk miles every day when your knees feel like sandpaper grinding together, or your hip protests with every single step. For someone with significant osteoarthritis, where the protective cartilage has worn away, and it's become essentially bone on bone, every impact, every twist, every sustained period of walking can exacerbate the pain, increase inflammation, and, paradoxically, accelerate the degenerative process. It's not just about discomfort. It's about actual physical wear and tear that's being worsened. When you push through that kind of pain consistently, your body responds by tensing up, creating compensatory movements that strain other joints, your back, even your neck. This constant state of inflammation and physical stress isn't just local to your joints. It creates a systemic inflammatory response throughout your entire body, and chronic inflammation, as we're learning more and more, is a silent enemy for heart health. It contributes to arterial stiffness, plaque buildup, and generally puts an added burden on your cardiovascular system. So, while walking can be good for mild joint stiffness, for severe, unrelenting pain, less truly can be more. Instead of those long, painful walks, the actionable step here is to pivot towards non-weight-bearing exercises. Think about swimming or water aerobics. The buoyancy of the water provides incredible support, taking the strain off your joints while still allowing your muscles to work and your heart rate to elevate. It's a fantastic way to get a full-body workout without the impact. Stationary cycling, where you can control the resistance and minimize joint impact, is another excellent alternative. You can even enjoy chair exercises, focusing on gentle leg lifts, arm movements, and core strengthening, all from a seated position. These movements help maintain muscle strength around your joints, improve flexibility, and boost your circulation without causing further damage. The key is to listen to your body's signals. Pain is not something to be ignored or pushed through in this scenario. If your pain is minimal and you still enjoy short walks, try to stick to softer surfaces like grass or an indoor track, and keep the duration brief. Most importantly, consult with a physiotherapist. They can assess your specific joint issues, teach you personalized exercises that are safe and effective, and even suggest mobility aids if needed. Remember, the goal is not to become sedentary, but to find smarter ways to move that promote healing and overall well-being. Rather than causing more harm, reducing the constant inflammatory burden on your body by easing joint pain will, in turn, be a kindness to your heart. Now that we've explored why severe joint pain means a rethink for your walking, let's turn our attention to another crucial area where less might truly be more. For your health and longevity: uncontrolled high blood pressure or certain severe, unstable heart conditions, such as advanced congestive heart failure or unstable angina. It might sound counterintuitive, doesn't it? We're always told exercise is good for the heart, and it is, for most people. But if your blood pressure is consistently very high and not well managed by medication, or if your heart is already significantly weakened or experiencing unstable chest pain. Sudden or intense physical exertion, like a long brisk walk, can put dangerous strain on your cardiovascular system. Imagine your heart as a pump. If the pipes it's pumping through your arteries are severely narrowed or stiff due to uncontrolled high blood pressure, or if the pump itself is already struggling to function efficiently due to a severe underlying condition, then asking it to suddenly work harder during a walk can be like revving a car engine that's already overheating. It increases the heart's workload and oxygen demand beyond what it can safely handle. This can lead to a dangerous spike in blood pressure during exercise, or even trigger cardiac events in already compromised hearts for someone with advanced congestive heart failure. For example, even a moderate walk might push their already struggling heart past its limits, leading to increased shortness of breath, fluid retention, and worsening of their condition. Similarly, if you experience unstable angina, chest pain that occurs with minimal exertion or even at rest, walking could provoke a heart attack. The benefit of exercising the heart is vastly outweighed by the immediate risk of an acute cardiac event. So, what's the actionable step here? The absolute paramount advice is to consult with your doctor before making any changes to your exercise routine, especially if you have a known heart condition or uncontrolled high blood pressure. Your doctor might need to adjust your medication to stabilize your condition first. Once cleared, your approach to movement should be incredibly gentle and carefully monitored. Think about very short, low-intensity movements. This might mean walking for only 5 to 10 minutes at a very slow pace, multiple times throughout the day, on a flat surface, with no hills, and stopping immediately if you feel any exertion, breathlessness, dizziness, or chest pain. The goal initially isn't to get your heart rate up, but to simply encourage very gentle circulation without putting undue stress on your already vulnerable system. Many individuals with severe heart conditions benefit immensely from supervised cardiac rehabilitation programs. In these settings, healthcare professionals monitor your vital signs and guide you through safe exercises, gradually increasing intensity only as your heart's capacity improves. This ensures that every movement is beneficial and safe, rather than risky. John, for example, had a significant history of heart issues. His doctor had him focus on medication and very light, supervised movements for months, rather than his usual long walks, until his condition was truly stable. This cautious approach prevented dangerous strain and gave his heart the time and support it needed to recover, ultimately leading to a much safer pathway to regain activity. This strategic, medically guided approach truly protects your heart for the long run. Now that we've discussed why severe joint pain and specific heart conditions mean a rethink for your walking, let's turn our attention to another crucial area where less might truly be more for your health and longevity, and that is peripheral artery disease, particularly when it presents with significant claudication. Peripheral artery disease, often called PAD, happens when narrowed arteries reduce blood flow to your limbs, most commonly your legs. This reduced blood flow causes a cramping pain in your calf or thigh muscles when you walk or exercise, which typically goes away after a few minutes of rest. This pain, called claudication, is your body's way of telling you that your muscles aren't getting enough oxygen. While structured, supervised walking programs are a cornerstone of PAD treatment for some individuals, where you walk until pain begins, rest, and then walk again. This is a very different scenario from simply pushing through severe, debilitating pain on your own during long, unsupervised walks. If you have significant claudication and consistently try to walk long distances, forcing yourself through intense leg pain, you're not strengthening your legs. You're essentially starving your muscles of oxygen. This can lead to increased muscle damage, more severe pain, and potentially even slow the healing of any minor cuts or sores on your legs, increasing your risk of infection or non-healing wounds, a serious complication for PAD patients. The constant struggle and pain can also elevate your stress hormones, which puts added strain on your heart, already working harder to pump blood through narrowed arteries. So, for severe, uncontrolled claudication, the traditional advice of just walk through the pain can be counterproductive and even dangerous. The actionable step here is, once again, to work closely with your doctor and a vascular specialist They can help you determine if a supervised exercise program is right for you and how to safely incorporate movement. If intense walking isn't advised for your specific PAD severity, focus on gentle exercises that promote circulation without triggering severe pain. Things like calf raises while sitting, foot flexes, and ankle rotations can help keep the blood moving in your lower legs. Upper body exercises can maintain overall fitness. Very short, slow walks, if cleared by your doctor, might be part of your routine. But the absolute key is to stop at the first sign of pain. Rest, and never push through severe discomfort. Elevation of your legs when resting can also help with circulation. And critically, if you smoke, quitting is the single most important thing you can do for PAD, as smoking drastically worsens the condition. Sarah, for instance, had such severe leg pain from PAD that she could barely walk a block, instead of forcing herself through agony, which only left her exhausted and in more pain. Her doctor enrolled her in a supervised rehabilitation program. There, she learned safe ways to exercise, gradually increasing her tolerance under expert guidance, which was far more effective than her previous attempts to power through the pain on her own, which had always left her feeling worse. Now, let's consider another crucial group where less walking, or at least highly modified walking, is essential for safety and longevity individuals experiencing frailty, significant balance issues, or a high risk of falls. While walking is often recommended to improve balance and strength, for someone who is already very unsteady on their feet, whose muscles have weakened significantly, or who has a history of falls, embarking on long, unsupervised walks, especially outdoors on uneven surfaces, drastically increases the risk of a serious fall. A fall for an older adult isn't just a minor inconvenience. It can lead to devastating consequences: hip fractures, head injuries, loss of independence, and, often, a rapid decline in overall health and quality of life. The potential benefits of walking are overshadowed by the immediate and severe danger of a fall. The aim here is to build strength and balance safely, not to put oneself in harm's way. So, what should you do instead? The focus shifts from general walking to targeted, controlled balance and strength exercises. Think about activities like Tai Chi, which is fantastic for improving balance, coordination, and proprioception, your body's awareness of its position in space, all in a slow, controlled manner. Chair yoga or other seated exercises can strengthen your legs and core safely. Standing exercises, performed while holding on to a sturdy countertop or a secure piece of furniture, allow you to work on leg strength and balance without the risk of falling. A physical therapist is an invaluable resource here. They can conduct a thorough assessment of your balance and strength deficits, identify specific areas of weakness, and design a personalized exercise program that progresses safely. They can also teach you how to use assistive devices like a walker or a cane correctly, ensuring they are properly fitted and used to enhance stability when necessary. Beyond exercise, modifying your home environment is crucial. Removing trip hazards like loose rugs, ensuring good lighting, and installing handrails where needed. If walking is part of your routine, keep it short, indoors on flat, even surfaces, and ideally, have someone with you for support. Mr. Henderson, for instance, became very unsteady after a bout of pneumonia. His well-meaning family encouraged him to take long walks around the block, but he would often stumble. It wasn't until a physical therapist stepped in and focused on controlled, seated leg lifts and standing balance drills, slowly progressing him to very short, supervised walks with a walker, that his confidence and stability truly began to improve, drastically reducing his fall risk. This targeted approach is about building a safer foundation for movement, ensuring that every step you take contributes to your well-being, rather than posing a threat. So, we've talked about how, for certain serious conditions, things like advanced osteoarthritis making every step a struggle, or when your heart is already working overtime due to uncontrolled high blood pressure or other significant heart issues, or even that cramping pain from peripheral artery disease that signals inadequate blood flow, and certainly when you're feeling frail and unsteady with a high risk of falls. Sometimes, the answer isn't walk more, but walk smarter, or even walk less. in favor of safer, more targeted movements. But there's one more overarching principle that often goes overlooked, and it directly relates to how your body perceives and reacts to physical activity when it's already under internal stress. That's the state of chronic pain and inflammation, especially when it's widespread and not just localized to one joint, or when you're dealing with conditions like severe fibromyalgia or chronic fatigue syndrome, when your body is in a persistent state of widespread chronic pain or systemic inflammation. Pushing through strenuous activity, like long, vigorous walks, can actually be detrimental. Imagine your body is already fighting an internal battle. It's expending immense energy just to manage the pain and inflammation. Adding intense physical stress on top of that can elevate your stress hormones, like cortisol, further fuel the inflammatory fire, deplete your already limited energy reserves, and trigger vicious cycles of pain and exhaustion. This isn't about laziness, it's about physiological reality. Your body interprets this overexertion as a threat, and it can actually worsen your symptoms, making you feel more fatigued, more achy, and even more prone to flares of your condition. This chronic stress and inflammation, in turn, takes a toll on your cardiovascular system over time, contributing to systemic issues that impact heart health. The goal for these individuals isn't to increase cardiovascular exertion through walking, but to gently support the body's healing, reduce stress, and carefully build resilience without pushing it over the edge. The actionable step here is all about mindful movement and intelligent pacing. Learn to truly listen to your body's unique warning signals. Don't overdo it on your good days, thinking you need to make up for lost time, as this often leads to a severe crash the next day or even for several days. Prioritize rest and recovery as much as you prioritize movement. For movement itself, think gentle, restorative activities. Tai Chi, as we mentioned, is wonderful for mindfulness and gentle strength. Very gentle yoga. Stretches that focus on flexibility and relaxation can be incredibly beneficial. Mindful breathing exercises, even done while seated, can help regulate your nervous system and reduce the body's pain response. Short, very slow, pleasant strolls, when you genuinely feel able and without pushing through pain or fatigue, can still be incorporated. But the focus should be on enjoyment and gentle movement, not on distance, speed, or meeting a step count. It's also crucial to work with your healthcare provider to address the underlying chronic inflammation or pain condition through diet, sleep management, stress reduction techniques, and appropriate medical treatments. David, who suffered from chronic fatigue and widespread pain, used to feel guilty for not taking long walks. Every time he pushed himself, he'd end up completely drained and in agony for days. It was only when he started pacing himself, doing much shorter, very gentle movements on his truly better days, and allowing himself generous rest, that he found his overall energy levels slowly began to climb, and his pain became more manageable. This shift also significantly reduced his stress, which, in a beautiful ripple effect, indirectly helped his heart. Remember, this isn't about telling you to stop moving entirely. Quite the opposite. It's about empowering you with the knowledge to make informed decisions about your movement, tailored to your specific health. It's about listening to your body's unique language and respecting its limits, especially when those limits are signaling a serious underlying condition. Small, smart changes can make a monumental difference to your health, your longevity, and your heart health. Sometimes, the most beneficial path forward is not the one we've been told is universally best, but the one that truly nurtures and protects your body. Have you ever found that walking too much made a condition worse? Or have you discovered alternative movements that truly helped you feel better? Share your experiences in the comments below. Your insights could help so many others in our community who might be struggling with similar challenges. If you found this video helpful and want to discover more ways to live your healthiest, happiest life at every age, please give this video a thumbs up. And don't forget to subscribe to our channel and hit that notification bell so you don't miss out on our future videos packed with practical, life-changing advice. You are capable of so much, and by making these smart, personalized choices, you can truly live your best life, vibrant and full of joy. At every age, take care of yourself, and we'll see you in the next video.